Alright, well, I had the upper extremity musculature, and I would just like to start off by saying that there are two compartments of the upper extremity, and that is the anterior and posterior. The anterior deals with flexor muscles, and posterior deals with extensor muscles. The upper extremities include the scapula, shoulder, arm, forearm, and hand. So we've already gone through probably a little less than half of the upper extremity so far. So I'm just going to kind of recap on what we've already gone over on the upper extremity. We've already gone through the shoulder joint and shoulder girdle, and those include the pectoralis major, subscapularis, the coracobrachialis, the deltoid, supraspinatus, latissimus dorsi, the teres major, infraspinatus, teres minor, the pectoralis minor, subclavius, the serratus anterior, trapezius, rhomboid, and levator scapula. The movements of the shoulder girdle and joint also are a wide range because it is a saddle joint, and that would be elevation, depression, upward rotation, downward rotation, protraction, retraction, flexion, extension, abduction, adduction, horizontal abduction, horizontal adduction, medial and lateral rotation. So I found some pictures on the internet to kind of illustrate some of the muscles that we were recently talking about. I found it easier to visually see how these muscles are working in certain exercises, and it kind of helps apply the what we're learning. So the top left is a dumbbell front raise, which is using the deltoid, but it is also using some other muscles. The top right is a decline push-up, which is the main muscle is the pectoralis, and it is also using the triceps. The bottom left is a barbell shrug, which is using the traps or trapezius. And then the bottom right is a lat pull down, which is obviously using the latissimus dorsi, and it is also using the teres major, along with other muscles, but those are the main muscles being used in that exercise. So before kind of going on, I kind of wanted to cover the elbow, radial ulnar joint, and the wrist and fingers main movements, just to kind of like get it in your head, I guess. So the elbow and radial ulnar joint deals with more flexion, extension, supination, and pronation, and the wrist and fingers deal with more flexion, extension, flexion, and opposition, abduction, and adduction. So, in the green right here, as you can see, is the brachialis, and the main function is flexion. And the origin is the anterior surface of the distal half of the humerus. And the coronoid process and tuberosity of the ulna is the insertion. And you can see that the brachialis covers that elbow joint. So this next picture is of the biceps brachii. The action is flexion, and it also helps stabilize the shoulder. The origin of the long head, which is the more lateral muscle, is the long head is superior margin of the glenoid cavity, and the short head is the coracoid process. The insertion is the tuberosity of radius and the fascia of forearm. So kind of like what I was saying, the short head is more medial to the long head. So I also found another picture, and this is kind of illustrating a barbell curl, and it is igniting or firing of those muscles that we just talked about, which was the brachialis and the biceps brachii, um, which deal with flexion. The muscle that is highlighted in green is the brachioradialis. The main function or action is it flexes the elbow. The origin is the lateral supracondylar ridge of humerus, and the insertion is the lateral surface of radius near styloid process. The muscle that kind of lies behind the brachioradialis is the pronator teres, and that action deals with pronation, and also kind of deals with the flexion of the elbow. It kind of helps with the brachioradialis. The origin is the humeral shaft near medial epicondyle and the coronoid process of the ulna, and the insertion is the lateral surface of the radial shaft. This picture also kind of illustrates the pronator teres at a different angle, which it highlights it in like a pinky kind of color, kind of how it goes under the brachioradialis. The flexor carpi ulnaris is the one that's highlighted in the yellow. The action is it flexes the wrist, and the origin is the medial epicondyle of the humerus, medial margin of the olecranon, and the posterior surface of the ulna. The insertion is the pisiform, hamate, and metacarpal. And the flexor carpi radialis, which is highlighted in the green, and that action is also flexion. And the origin is medial epicondyle of the humerus, and the insertion is the base of the metacarpals. It's kind of difficult to see, but the flexor pollicis longus is on the thumb. Pollicis is actually another name for thumb, and that action deals with flexion of the phalanges of the thumb, and the origin is the radius and interosseous membrane, and the insertion is the distal phalanx. All those muscles that I kind of just went through were on the anterior side, which dealt with flexion, and now we're more focused on the posterior side now, and we're now looking at the triceps brachii, which the action is extension, and it also deals with adduction. The origin, so there is a long head, a lateral head, and a medial head. The long head is the origin is the inferior margin of the glenoid cavity and joint capsule. The lateral head is posterior surface of proximal end of humerus, and the medial head is the posterior surface of entire humeral shaft. The insertion is the olecranon fascia of the forearm. So the long head is the green, the one that's highlighted in the green. The lateral head is the kind of orangey, and the medial is, you won't be able to see it very well, but it is under the green kind of, and that would be more by your ribs. A good exercise to build your triceps would be tricep dips, and you can see how much the triceps are being used in this exercise by this picture. We're going to cover a few of these muscles, And we're going to start with the anconeus, which is highlighted in the green. That action extends the elbow, and it also helps with pronation. The origin of the anconeus is the lateral epicondyle of the humerus, and the insertion is the operculum and posterior surface of ulna. The extensor pollicis longus, which is down two muscles, it deals with extension also, and it also deals with adduction and lateral rotation. And the origin is posterior surface of the ulna, the interosseous membrane, and the insertion is the distal phalanx. The extensor pollicis brevis also deals with extension, and the origin is the shaft of the radius and interosseous membrane, and the insertion is the proximal phalanx. The picture on the left illustrates the extensor carpi radialis longus, and that action is extension, and it also helps with flexion of the wrist. The origin is the lateral supracondylar ridge of the humerus, and the insertion is the base of the metacarpal. The picture on the right shows the supinator, which helps supinates the arm. The origin is the lateral epicondyle of the humerus, the supinator crest and fossa of ulna, just distal to radial notch, and the ulnar and radial collateral ligaments of the elbow. The insertion is the proximal 1/3 of radius. This picture shows the supinator, extensor pollicis longus, and the extensor pollicis brevis a little bit better. The supinator is the muscle more by the elbow joint, and it's in like that pinky kind of color. You can kind of see how thick that muscle really is. The extensor pollicis longus is in the green. You can see how far it attaches to the thumb joint or the thumb, and the extensor pollicis brevis is in the yellow, and you can see where the extensor pollicis longus and brevis kind of meet or join, and where the extensor brevis kind of ends. Here is another kind of angle on the extensor pollicis longus and the brevis. The extensor pollicis longus is in the blue, and the brevis is in the green, along with the abductor pollicis longus, which attaches at a different point. Here are some exercises that I found that dealt with the arm and the forearm muscles. The first one would be the top left, which is known as the farmer's walk. It deals with more of the forearms, as you can see how that's highlighted. Obviously this exercise uses a lot of different kinds of muscles, but these forearm and wrist flexors are also included in this workout or exercise. This next one is the top right, which is a chin-up, and this deals with the biceps. Along with the farmer's walk, a lot of muscles are being used during this, like the latissimus dorsi and the teres major and minor, or yeah, major, sorry. But what I'm trying to point out is that the brachialis and the biceps brachii are being used in this exercise. The next one is skull crushers, which is on the bottom left, and triceps are probably the main focus of this exercise, as you can see, but also the forearms are being used. I found these pictures on the internet. I thought it was kind of cool because it illustrated all the different muscles that swimmers use. I also included 4 other pictures trying to illustrate the strokes if people didn't know. I guess I don't think it really does the strokes justice, but I tried. Um, so the front crawl is the top left, and you can see in both pictures that it's highlighted in green in the middle picture, how the triceps are being greatly used for that exercise. In the top right is the backstroke, and in the middle picture you can see how the deltoids are a big help in that exercise, or that, exercise. The bottom left would be the breaststroke, and you can see that in the middle it is highlighted in yellow, and the pectoralis is the main muscle for the upper extremity for that, and the butterfly is on the bottom right, and for the middle you can see that the trapezius is a big help for the butterfly exercise. I thought this picture kind of illustrated the nerves very well in the upper extremity, um, like the axillary nerve, how it runs through the deltoid, and then the radial nerve kind of goes more through the bicep, but then it also kind of goes through the triceps and down your forearm in the posterior. Um, and the ulnar nerve is more on obviously your pinky side, and I thought this was a very good illustration and kind of shows how your nerves um, innervate your upper extremity. So the injury that I chose, or one of the injuries that I chose, was the carpal tunnel syndrome. This deals with the median nerve and how it gets pinched or disrupted in the carpal bones, which causes weakness and pain in the hands and wrist. So it deals with the muscles in your hands and the wrist. It's a underlying medical condition, and which causes poor blood circulation. And what can be done is by wearing a splint, or taking anti-inflammatory drugs, or just resting it and putting ice, I guess, on it. Also, if it gets bad enough, you can also get surgery on it. The next injury that I chose was the tennis elbow. This is due to the tendons being like repetitively worked, the same movements for a very long time. You typically get pain in this area, the lateral epicondyle, and the cause, like I said, the repetitive motions. And it's not just athletes that get this injury, it's also any worker that is doing the same movements day after day. What can be done is just rest and pain relievers.